Hi and welcome to my channel. I am so happy to see you today. If you are new here, subscribe, share with your friends, hit the notification bell so that you are notified whenever I release a new video. Today we are going to talk about appendicitis. But what is appendicitis? It is the inflammation of the appendix. The appendix is located where the small intestines joins the cecum. This is the location of the appendix. But what causes its inflammation? There can be a tumor, that is a growth near the area that can cause blockage and therefore inflammation. Another thing that can cause appendicitis, there can be a fecal obstruction. Feces can close the appendix, and this can cause inflammation. The third one can be infection. Infection in your gut can lead to your appendix being inflamed. But then how can you know whether this is your appendix that is inflamed or not, or something else? There are three things that you will be able to know about whether it is the appendix that is a problem. The symptoms are: 1, continuous pain. You will be having continuous pain, and this pain starts at what we call the peri-umbilical region. That is the area around the umbilicus. This pain continues around that area, and it is continuous. Even when you take medication, it does not even relieve this pain. And then it spreads to this area, which we call the McBurney's region, to your groin region, and it continues for some time. That is 1. 2, you will be feeling, there is loss of appetite, what we call anorexia. You will not even want to eat. 3, you will be feeling nauseated. Even when you want to eat food, you will feel like you want to vomit, and there is even vomiting. So nausea and vomiting. These are the 3 symptoms that will help you know that you are having an appendicitis. Pain that is continuous, that starts at your peri-umbilical region and continues and settled as your right groin region, that is what we call the McBurney's area. 2, you will be having anorexia. 3, you are having nausea and vomiting. But then what are you supposed to do if you are having this appendicitis? Appendicitis is treated by, acute appendicitis is treated by what we call appendectomy. Appendectomy is a surgical procedure for removing or coming out or excising and removing the diseased or inflamed appendix. Now, how is it done? It can be done 2 ways. 1, what we call laparoscopic appendectomy, in which case we make keyhole incisions across your abdomen, especially near the right area, the right lower region of your body. That is where the surgeon is going to make a few incisions, and we are going to use a scope, a small instrument that is put in your tummy that will help visualize the appendix. And then there are some working instruments that are placed in there, and they are used to identify where your appendix is, and then it is removed. The beauty with the laparoscopic appendectomy is, 1, it takes you will take fewer days in the hospital. 2, the incisions are very small, so it means the recovery will take a shorter period of time. 3, it even has fewer complications post-operatively. So that is the beauty with laparoscopic appendectomy. The second way of handling acute appendicitis is open appendectomy. In this case, a laparotomy or a small incision is made in the location, that's the right lower region, what we call the McBurney's area, and then your surgeon will identify, will go through the muscles and will open up a small incision and open up the area and identify the appendix. Cut it out, remove it, wash the area and stitch it up. So those are the two areas the two procedures that we use for when you are having an acute appendicitis. Now, during recovery, what are you supposed to bear in mind? Number one is pain relief. Since this is a surgical procedure and we have cut through the muscles, you are going to feel pain. So you are going to be given pain relieving medication. Number two, you are going to be given antibiotics, which are medicine that will help you and to kill any germs that may be around. And then the third thing is about care of the dressing of the incision area. So you need to make sure that it is dry, there is no water that gets to the area, to ensure that you promote quick healing. The next thing you will do is your diet that you need to eat so that it helps in the healing of the place that was incised. So these are the two procedures that needs to be done, and I've already covered the signs that you will know for you to know that you are having acute appendicitis. And if I may go through them again, there can be pain, periumbilical region pain that is continuous and settles at the right lower region. You also are going to be having nausea. You are going to be having vomiting and even loss of appetite. Once you discover that these are the symptoms that you are having, do not stay home. Go to the hospital where you'll be taken care of and your problem will go away. This has been an exciting session where we have talked about acute appendicitis. If you are having any questions, comment in the comments below, share with your friends, and if you have not subscribed yet, hit the subscription button and the notification bell. See you in the next one. Bye.